SCORE Northeast Wisconsin and WHBY are pleased to bring you Biz Talk, a chance for you to hear from entrepreneurs and professionals as they share their experiences. From starting to sustaining growth, learn the skills needed for your business to be successful. If you miss anything, you can catch the Biz Talk podcast at score.org/Northeast Wisconsin. And now from the Myron Construction Studio, it's Biz Talk on WHBY.
A good Saturday morning to everybody. I hope you're having a great June so far. My name is Terry Pinch, and I'm one of the co-hosts this week. Joining me as co-host for Biz Talk with SCORE is Rick Sintz. Rick, how are you this weekend?
I'm doing very well, Terry.
Been out biking?
I have, actually. Yes, it's been, other than the rain we had this last week, which kind of put the kibosh on it a little bit, I've been enjoying myself quite a bit so far.
Yeah. I will just mention one thing. The warning came through about the storm yesterday, and it talked about things to watch out, and it said, mobile homes will be heavily damaged.
Okay.
Well, that's quite a prediction. But anyhow.
I was in Chilton, and they were talking like 90-mile-an-hour winds, and it's probably not the best time to get on a bike. So.
No. I got out before. But anyhow, thanks for joining us again this week, Rick. And this week, we're talking to Five Star Insurance Group. And joining us are Patti-Jo Heinritz and Justin Zastrow. Welcome to the show.
Hello.
Thanks for having us.
Okay. So let's start first with Patti-Jo. Can you let people know kind of your background and how this ended up as your career path, how you got to where you are?
Well, actually, I'm originally from Green Bay, Wisconsin. And I started in the insurance industry back in 1986. I worked at Employers Health Insurance in De Pere. So I've been in the business for almost 40 years. I worked in group insurance back then, underwriting, sales. And then I actually moved to Chicago for sales and then eventually Arizona. My father wasn't doing very well. He actually had cancer, so I ended up in 2004 moving back to the area. I started working at United Healthcare under Medicare in 2006, and I was offering Medicare Advantage plans, and I just loved it so much. I loved the interaction with the seniors, and it just felt so fulfilling to me to make a difference that I wanted to make this my business. So I moved to Menasha, and I built my own agency, P.J. Tollner Insurance Agency, which is my maiden name. And I just worked out of an apartment and did in-home appointments. And I traveled throughout the state and just went to people's homes and enrolled them and educated them on Medicare. Once I realized that just being captive with one company, which United Healthcare was my company, was not as beneficial to my seniors, I said, hey, I'm going to go independent. So I am an independent insurance agency, which gives all of my clients better options or more options, Medicare Advantage, Medicare Supplement. And then I just kind of grew the business and added 3-4 salespeople. Well, right now we have 4 salespeople, including myself. I have 2 admin people, and I do have a team development manager that kind of keeps us all in line.
So, Justin, let us know about how you got into this field.
Yeah, so I originally was going to teach middle school, and when I had graduated college, trying to find a job that actually was going to keep me for a long time wasn't really feasible at the time. This is 2003, 2004, and it was really hard to get something steady. So I just kind of fell into health insurance, and it turns out that having that teaching background worked really well. And when I translated into health insurance, I worked for Blue Cross Blue Shield of New Jersey for almost 13 years. I was in Green Bay. I was in New Jersey. They had me travel all over for that. And then eventually I wanted to move back to my home state too. So I came back to Appleton and I said I wanted to do something independent. I had worked for a specific insurance company for a very long time. I wanted to kind of be able to do a little bit more. And that teaching background translated really well into working with seniors. And people that needed health insurance, unlike teaching, they wanted to know the information that I was spewing instead of just sitting and suffering through it. So it worked out really good. And I love the job. I love working with people and helping them find the right plan that fits for them, and just being there as both a salesperson as well as like an educational resource.
Okay. So let's start then with an overview of the services that 5-Star offers.
So we offer, we do Medicare educational events. So you can find that on our website. We do that monthly here in our office. So people turning 65 can sign up for one of our events, and we walk them through what Medicare is, how it works, what the difference is between a Medicare Advantage and a Medicare Supplement. It's very informative. We also do some meetings in Wapaka. We do have on our website a video, so if they're interested in knowing more about Medicare, they can hop on the video.
We also do consultations for people that are under 65 that are looking for health insurance. Maybe they lost their job, so they're looking for an insurance plan to kind of gap them until they go on Medicare. People that turn 26 and are kicked off of their parents' plan, that is a very common reason why people would be looking for an insurance option. Even people that are just retiring, and they're retired, they're ready to live their life, and they need some insurance that isn't offered through a group anymore. We work closely with a lot of financial planners, actually, to help them with their clients and get their clients a plan that both is within their budget and meeting the needs that they have.
So we also, most of our appointments are in the office, so we do in office, but we also do Zoom calls over the phone, and still do in-home appointments.
Okay. So, myself going through the whole issue of moving into Medicare and actually managing insurance in general from the time I retired 8 or 9 years ago, understand some of the complexity, but a lot of people seem afraid when they start hearing about Medicare and health insurance when you're retired. Is that experience you see with a lot of your clients?
Absolutely.
Fear of what's coming?
Yeah, it's fear, but also overwhelming because it's a lot of information they don't know. That's why we do the educational events. I've been doing these events since 2011, so 15 years. People just, it's a lot to take in. So I always say if you want to go to two meetings or do the meeting and then do the online video, it helps a lot because it's scary to them. It's unknown, and they're afraid that they're going to miss the boat or have to pay more, get penalized.
And there's a lot of misinformation out there. They're receiving information from all the insurance companies up to a year before they even turn 65. And I mean, I always kind of joke that you'll never have to worry about kindling to start a fire in the wintertime in Wisconsin because they send you so much Medicare paperwork.
Yeah, no doubt.
And it's hard to navigate through that, and that's really what we're here to do, and why people come to us is because we can kind of say like, okay, yeah, you got all that information, feel free to look through it, but let's make this a little bit more about you and not so much generalized information, which is what a lot of them just get.
When I used to do in-home appointments, before I'd leave, the client would always say to me, okay, I have this stack. Can you go through it and tell me what I should keep and what I should throw away? And I go, you can keep the Medicare and U-Book and pretty much everything else you don't need. So it was pretty interesting what they all get.
So as we talked a bit about the complexity and the fact that you actually do offer training or education for people who are going to be looking at moving into it. Let's just talk a little bit about a couple things. First of all, from your perspective, why should somebody moving into Medicare get training?
So they can make a decision with what they learn. So they can make an educated decision and not just I want what my friend has.
Yeah.
Or, the cheapest. You want to make sure that they understand what they're getting and what it covers, and make sure their medications and their doctors are covered.
Yeah, everybody's situation is very much so unique. We see it all the time where people come in and they say like, oh, well, I was at a barbecue this weekend and I was talking to my friend and they're on this plan and they get this and this and this. And I say, yeah, but do you go to the same doctors? Are you on the same medications? Sometimes they live in a different state, and what happens in one state is completely different than what happens in Wisconsin or in Florida. Mm-hmm. There's different regulations and mandates that are in place. So it is very much so a personalized search, and the more education you have, the better prepared you are to make a decision that's not going to cause you frustration 3-4 months into the year.
And why be an independent broker? Why is it so important for people to consider an independent broker?
Cost savings, because we look at multiple carriers, not just one company. We're not going to pigeonhole you into one company. We look at, like I said, multiple different carriers, and we're able to find the best option in the way of cost and benefits.
And later in the show, we'll talk a little bit about differences between the Medicare Supplement and Medicare Advantage plans. But as you're looking through those differences, how wide a range are people talking about in terms of cost when they look at Medicare plans? Is it maybe $50 a month, or can it be hundreds of dollars a month if they make the wrong choice?
Both. Yeah. A lot of it comes down to the medications, especially, okay. Or, perhaps they pick a plan that seemed really attractive. They saw a commercial on TV and they were like, wow, this is great. I love this. But then it turns out that none of their doctors are in the network. Now they're paying a higher cost for those doctor visits when they could have avoided that had they, done a little bit more research, got some education, came into one of our meetings and saw, which plan is actually going to be the best fit all around.
And so that, again, comes back to one of the advantages with an independent broker is there's not the pressure to sell a specific type of insurance plan.
Absolutely. Absolutely.
Okay. So as you look at how you built this business, because it's so service-oriented and you're talking about a field that makes people nervous when they talk through insurance,
right.
How did you build your reputation for service, and how do you maintain it with the staff and bring in new people to work with others?
Good question. I always say if I take care of my employees, they'll take care of my customers. And so customer service is number one for us. If you go online and look at our Google reviews, we're pretty proud to say that we have over 700 Google reviews, and they're 5-star. It's 5-star. We're 5-star because we're 5-star. I always tell my employees, we're not 5-star because we give 4-star rated service. We're 5-star because we give 5-star rated service. So yeah, taking care of my employees definitely makes them. And that's even when I talk to like different carriers, I always know if my sales manager is great, typically, she's being taken care of by her company, and the customer service is good with their company. So for me, you can tell a company if the owner of the business takes care of their employees, typically those employees are going to take really good care of their customers. Would you agree?
Yeah.
Do you have anything to add on that?
No, absolutely. Just having that flexibility in the office, like we do work from home. We're not just always in the office. We're able to go, meet with clients at their homes. We're able to work from home sometimes. We also hold a customer appreciation event every year how many people did we have attend?
We had 170 people attend, and that's really a special event. We have our carriers show up. We have giveaways. They have their own little table, and they can you can go right to your own carrier and talk to them and ask them questions. And then we have raffles. It's an ice cream social, It's from 1 to 3, and we do that every year. And every year it gets a little bit bigger, but it's really a great event.
And it just shows how we're not just salespeople. Like, we're always here for the clients and just keeping in touch with them.
Yeah, and one of our in our vision, actually, our mission statement, we're big with the community too. So, we make sure that Mary Beth Nienhaus is one of our companies that we work with, the Activity Center, the Senior Center in Appleton. We also assist with NAMI, National Association of Mental Illness. We do adopt a family every year. So being involved in the community is definitely important to us, and I think that says a lot to the customers and to the employees too, where we come from,
Okay, we're going to take our first break here. You're listening to Biz Talk with Score on WHBY. I'll be right back after these messages.
Welcome back to Biz Talk with Score on WHBY. I'm Rick Setz along with Terry Pinch this week. And we are having a great conversation with Patti-Jo Heinritz and Justin Zastrow from 5 Star. I want to make sure everybody catches that, 5 Star Insurance. And we're going to talk about that in a little bit. But I want to just take a moment to talk about Score. Score Northeast Wisconsin serves 29 counties in northeast and north central Wisconsin. We have more than 50 volunteers, each an expert in their field, and they offer entrepreneurs no-cost and confidential mentoring. Those areas of expertise include IT, social media marketing, cash flow, accounting, strategic planning, workflow, HR, retail, best practices, and many others. In order to register for a no-cost confidential mentoring session and or to learn more about Score Northeast Wisconsin, please visit our website at score.org/Northeast Wisconsin. You can learn more about how the Score chapter can assist you with starting and or growing your business, and you can complete an application for a mentoring session. Simply complete the online form and submit it to Score. Within a few days, a Score mentor will be contacting you to set up a meeting. And to support small business people, Score Northeast Wisconsin is always looking for new mentors. If you have experience you'd like to share with others, we'd love to talk to you. We welcome volunteers with experience in all aspects of business. Small business owners need your help, and your experience can make a real difference to their success. And finally, this reminder about the Biz Talk with Score podcast. The Biz Talk with Score podcast brings you the same real-world information and insights from experienced entrepreneurs and business leaders, just like Biz Talk with Score on WHBY. However, Biz Talk with Score podcast is available when you are. So listen and subscribe today, tomorrow, or whenever you want. Available on most podcatchers and podcast apps. So thanks again for joining us this morning on Biz Talk. And Patti-Jo, I'm going to just throw this question at you. I purposely kind of over-exaggerated your name on the bring back here. And why did you pick that name? I mean, can you give listeners a kind of how you walked through that process to arrive at that choice for your name?
Absolutely. So originally, my agency was called PJ Tollner Insurance Agency, which is my name. And I started hiring employees, and I thought, well, I need to have a real name, because if somebody messes up something, I don't want everyone to think it's me doing it or it's my fault. So I thought, I need a real name. And so these Medicare Advantage plans, and at that time I was basically selling Medicare Advantage plans, a few Medicare supplements, and I thought they're rated from 0 to 5, which 5 being the best. And I thought, well, 5 Star Insurance, that sounds kind of cool. And then I thought, you know what? The customers that come to me, they don't pay for our services. We're paid by the insurance companies. And I thought, with a 5-star hotel or a 5-star restaurant, they're usually pretty expensive. Well, 5 Star Insurance Group, it doesn't cost them anything to come to us. So I and get information and compare rates, and I thought, yeah, that's a good idea. And I ended up doing that in 2014. So it's been 5 Star for 12 years. I've been in business for 18 years. It'll be 18 years celebration this year.
And you're talking about that name and then the rating you mentioned earlier in the first segment too, how you've had hundreds of online reviews.
Yes.
Can I ask if you've had any that have not been a 5-star? And if
Oh,
so,
there's a couple out there.
okay,
There's a
yeah.
couple.
What have you done? What have you and Justin done to make them 5-star ratings after, what kind of things do you do and do you have to run and work with your customers on to fix anything that might go wrong?
Justin, you want to answer that?
Yeah, sure, absolutely.
Good question.
A lot of times the frustration that the customers are having when they give us a lower review, a lot of it has to do with miscommunication, expecting one thing and then finding something else. Perhaps the selection that they made wasn't quite what they wanted. And we work with them. We try to get in touch with them and say, okay, understand your point of view. We always come in from a point of understanding and really want to get to what is actually causing this low review and what can we do to not only hopefully get that review higher, but also fix your problem so that it doesn't happen in the future. Just saying like, oh yeah, bad reviews are going to happen. I guess everybody gets a bad review once in a while. We go that extra mile and really make sure that we understand why are they unhappy? What can we do to fix it? Because a lot of times their unhappiness isn't necessarily with us. It's with their insurance plan that they have. And so kind of acting as that middle person or that peacemaker, we really just try to go the extra mile and get that issue resolved, whatever it may be.
Yeah, and if I can add, if they call out a employee or myself, we definitely go the extra mile and call them up and make sure, not only email them or respond to their message, but we call them up and make sure that they're taken care of and that they're good with it.
So you have a name that you have to live up to with every person that you work with,
absolutely.
Yeah. Okay. All right. Well, I think we're going to just pause right now to take our second break of the morning. You're listening to Biz Talk with SCORE on WHBY, and we will be right back after these messages.
Welcome back to Biz Talk with SCORE. I hope you're having a great weekend. This week we have a really good show talking about healthcare insurance with a view toward medical and also people who are retiring before age 65, among other coverage. And we're talking to Patti-Jo Heinritz and Justin Zastrow from 5-Star Insurance Group. Before we get back to Patti-Jo and Justin, I have a very quick update for you. Most people know about our website and our educational opportunities that are on that website. Well, we've gone through a pretty significant update, and the website has changed, and the address has changed a little bit. The website itself looks really good now, and they made a lot of improvements. Unfortunately, it wasn't really made for a podcast to kind of refer to because our link is now changed to score.org/WI/Northeast-Wisconsin. So it's a lot to say, but it is a good site, and there is still a training and learning tab near the top where you can go in and have access to literally hundreds of different programs for small businesses. Most are free. There are some that have small fees where SCORE is bringing in people to help speak, and those events are held live first, and then they're available as webinars. But again, it's a great resource, and it's at score.org/WI/Northeast-Wisconsin. So go and take a look. There's some great programs out there. And take a look at the web page itself. You'll see a site for Biz Talk with SCORE as well, and with some links to our podcasts and other features on SCORE, including you'll see a picture of Rick and a whole update on his what he does. So with that,
don't scare our listeners, Terry. Don't scare our listeners.
With that, and my picture's from 8 years ago, so you won't recognize me. So with that, we'll turn to Patti-Jo and Justin again, and we're going to start talking about Medicare just because of letting people understand how this works and where the complexity comes from. So could you kind of give a kind of high-level overview of Medicare and what it is and how it works?
Sure. Actually, Medicare, you have original Medicare. So that's Part A and Part B. So your Part A is hospitalization, inpatient hospital, skilled nursing facility, hospice, home health care. That's no cost to you as long as you worked 40 quarters in your lifetime. Part B is your medical, so your doctor visits, x-rays, labs, outpatient surgeries. That does have a cost to it. It's $202.90 for 2026. There are deductibles. So with Part A, before Medicare pays anything, you have a deductible of $1,736. And then Part B has an annual deductible of $283. And then Medicare pays 80%, and you're on the hook for 20%. So to combat those deductibles and help pay that 20%, there's two options. One's a Medicare Advantage, which is called Part C, and one's a Medicare Supplement. There's also Part D, which is prescription drug. So with a Medicare Supplement, that's where Medicare is primary. You're going to show that Medicare card, and then the Medicare Supplement is going to pay the 20% that Medicare does not. With the Medicare Supplement, you can go to any doctor as long as they take Medicare. If they don't take Medicare, they won't take a Medicare Advantage or a Medicare Supplement. There's no referrals and there's minimal prior authorizations. It doesn't include drug coverage, so you'd have to get a separate drug plan unless you had VA, or senior care is another option. Then there's a Medicare Advantage plan. Like I said, it's called Part C, and that's where the individual insurance company is contracted with Medicare, and Medicare pays them to pay the bills. So you never show your Medicare card with a Medicare Advantage. It's more of a pay-as-you-go. A lot of those plans are zero premium, unlike the Medicare Supplement does have a premium to it, a cost. And so with the Medicare Advantage plan, the pay-as-you-go type plan, you just pay when you use it. Typically you don't pay when you don't use it, but it does cover additional benefits like dental, vision, hearing, gym membership, over-the-counter benefits, and a lot of these plans have the drug plan baked right in.
Okay.
Anything?
And just want to cover Part D a little bit too. Okay.
So Part D, the prescription drug, has changed over the years. There used to be what's called a donut hole. 2010 and before, if you hit that donut hole, you had to pay 100% of your drugs. Well, that didn't go very well. A lot of people were going off their medications. It was kind of a mess. So then they started to shrink that donut hole, and then in 2020, that's where it was capped. You'd pay 25%. Now in 2026, they completely got rid of the donut hole, and there is a max benefit that you'll have to pay out of your pocket. No matter what medications you go on, the most you will pay is $2,100. So that unfortunately has been affecting the Medicare Advantage plans and the Part D plans, where some of the benefits that the clients were used to are not as attractive as they once were. Would you agree?
Yeah. And one of the other things that just want to emphasize is, like, with that maximum out of pocket, that is based on covered medications. If the individual is trying to get a medication that wasn't covered by their plan or is not covered at all, that wouldn't apply to that maximum out of pocket. And that's another thing that we're seeing more and more now, where there's a lot of medications that maybe are very popular, but they're not covered by some of the Medicare plans. People are like, well, I thought I have a maximum out of pocket of $2,100. Well, not for those meds that aren't covered.
So one of the things I found interesting about Part D is that every insurance company covers different drugs.
That's right. They have a different formulary list.
Yep. So you have to research pretty much every year, correct?
Yeah, definitely. If they don't do it on their own, it's always good to use an insurance agent and run that by them.
Okay. And then for Part D, anyhow, it's easier to change insurance plans, is it, than maybe for other parts of the Medicare?
Yeah, with Part D, there's no underwriting. You would just change during the open enrollment period.
Just like Medicare Advantage. They have that annual enrollment period every year from October 15th to December 7th.
Yeah. And The next thing I want to cover is kind of that whole issue of Medicare supplement versus Medicare Advantage, because there's great things about both plans, but there is an issue where if I understand right, you have to be approved in year one, but if you try to move between programs after that, unless there's certain extenuating circumstances, you can then end up paying much higher rates. Is that correct?
Well, let me explain. So with the Medicare Advantage plan, there's never any underwriting. So what underwriting is, that's where medical questions are asked, and you have to fill out all of that information. With the Medicare supplement, with the Medicare Advantage plan, you have that annual enrollment period every year, so you can switch to a Medicare Advantage or switch between a Medicare Advantage, and there's, you won't be declined or denied. And then you also have from January 1st to March 31st open enrollment, so you have another time frame that you can switch from a Medicare Advantage to a Medicare Advantage. But with a Medicare supplement, when you first go on Part B, you have 6 months to go on a Medicare supplement, and there's no underwriting. If you wait till after that 6 months, then you may have underwriting where you may be rated up or declined. It's based off of your health history.
Yeah. So that was one of the interesting things I heard, is that if I decided to change my supplement plan in year 2 or year 3, there's underwriting involved again, and that could cost me some money.
Right.
So,
right. Or you could be declined.
Yeah.
Right.
So let's talk a little bit more about Advantage plans right now. What are the pros and cons of an Advantage plan?
Well, a lot of them are zero premium, so it's a pay as you go, so you only pay when you use it. Wouldn't it be nice if our homeowners or our auto insurance was you only pay when you use it? So that is definitely a benefit. They have an out-of-pocket maximum, so there's a cap on what you'll pay out of your pocket. It does include the drug coverage baked in on a lot of the plans, so that's always a nice benefit. If you're on a zero premium plan, you're not paying a premium for that just to have that drug plan. And then there's additional benefits like dental, like vision, like hearing, gym membership. So that's always a nice benefit to have. A lot of people like that.
And then on an Advantage plan, how does it work for getting approval for certain treatments? Do you have to have that approval done?
Yeah. With Advantage plans, a disadvantage would definitely be the prior authorizations, unlike a Medicare supplement, where there's very minimum prior authorizations. With a Medicare Advantage, if you need an injection in your back, or you need a surgery, or you have a Part B drug that you need, or a CAT scan or an MRI, there's definitely going to be prior authorizations that you need to get beforehand.
So as people start to think about Medicare, whatever program they get through, once you start to think about deductibles, people have to remember it's not free. I know some people think that, but overall, you're going to have to pay some money for your Medicare coverage, correct?
Correct. With the Medicare Advantage, the nice thing is they take care of those deductibles. With the Part A and the Part B deductible, that's taken care of. With a Medicare supplement, those deductibles, you get a rider to take care of your Part A. Your Part B, you may, if you turn 65 or go on Part B, Part A or Part B after 1/1 of 2020, then you're on the hook for that Part B deductible. But with a Medicare Advantage plan, the copays, you always have those copays. So if you need a surgery or hospitalization, there's always going to be copays that you have to pay, unlike the Medicare supplement.
Okay. So just that's one thing. Sometimes people think Medicare is free, and it's not. There's some aspect of it. But the other piece comes in that I hear a lot about, heard numerous times about, is long-term care. Does Medicare cover long-term care?
No, it doesn't. It does not cover long-term care. If you want long-term care coverage, you need to get long-term care. It covers skilled nursing facilities. So if you go into a rehab center, With a Medicare Advantage plan, you have to show improvement. If you don't show improvement, you won't, they will either ask you to pay in full or, they'll ask you to leave. With the Medicare supplement, you do get a little more coverage. If it's not covered by Medicare, you do get additional 30 days. In the state of Wisconsin, you have state mandated benefits with a Medicare supplement for chiropractic care, cancer, clinical trials, skilled nursing facility. So you do get additional coverage, which is nice on a Medicare supplement.
Okay. So this is about why it's so important to talk to a broker or somebody really knowledgeable about Medicare, because one, there are costs incurred. Two, doesn't cover certain things people might think it does. And it's really important to be educated about it. And that's where your Medicare 101 events come in, as well as your regular discussions with clients, correct?
Absolutely.
All right. Let's switch to talk a little bit about those people who retire before age 65 and need medical coverage until they get to Medicare. How does somebody start going about doing that?
I always say, number one, figure out who you're going to cover, where you're going to live, and what do you expect your income to look like for the year. Because right now, for under 65, those are kind of like the linchpin questions. Talking to your financial planner, talking to whoever is handling your wealth management, your retiree process, that's a good place to start. As we mentioned earlier, I work with a lot of financial planners. Patti-Jo works with a lot of financial planners. All of our agents do. And we kind of say, what is their income going to look like? Because that income plays into any tax credits that they may qualify for to help bring down that premium. And in the years past, there was a time where people that had much higher incomes could still get a really nice tax credit and get really affordable coverage. Unfortunately, things have changed, and that is kind of gone by the wayside. And now people need to really watch their income, or they could get a tax surprise that is not so positive when they file their taxes. We've heard horror stories. I mean, everybody that has talked about being on the marketplace, you've probably heard somebody say, oh, yeah, I had to pay back $10,000 to the government. And they like to blame their insurance plan, but a lot of times it's just poor financial planning, or they didn't tell the marketplace or didn't tell their insurance agent what their income actually ended up being.
Okay. So what is available for somebody who needs insurance?
Well, it's based on the county. And again, a lot of people kind of have this misinterpretation of the marketplace or Obamacare. They think like, oh, I'm getting Obamacare and that's their insurance. That's not actually correct. The marketplace is a place where they can shop for insurance plans offered by insurance companies. And based on where they live, who's going to be on the plan, what the income is going to look like, are you a smoker, a number of different factors, we can kind of establish what plans are going to be available. And those plans do change from year to year. Right now, most of the plans are very much so state-based. So if you take a plan here in Wisconsin and you go travel to Florida outside of an emergency, that plan isn't going to really help get you much coverage, if at all. I joke with some of my clients that it's easier for me to insure you outside of the country than it is to insure you outside of Wisconsin. If you're going to travel, get out of the country, go travel, go see the world. Because it is easier to insure them. I mean, it really is. Travel insurance is a lot easier than to get something for going to the Colorados or something like that.
And so this is another area where the laws change pretty regularly. And a person's choice is either to keep up with those changes themselves or talk to a broker and have the broker do those changes.
That's right.
Tracking. Okay.
Yeah.
So in a minute or so we have left, let's just talk quickly about, well, great, somebody under age 65's got their medical figured out. But what about other things like dental and medical or dental and vision, for example? Can they come to you and get help with that as well?
Absolutely. Absolutely. We have several different options for dental, vision, hospital indemnity, which pays your co-pays, hospital copays or your outpatient copays. That's definitely a benefit or a product that's becoming more popular because of the cost of the Medicare Advantage plans and the Affordable Care Act plans or the marketplace plans. So yeah, we do a lot of ancillary. We also do life insurance.
And the travel plans outside of the country.
Yep, we do trip and travel.
Okay. Well, we are at the point where we're going to take our third and final break. You're listening to Biz Talk with Score and WHBY, and we'll be right back after these messages.
You can start in 5 seconds.
Welcome back to Biz Talk with Score. We'd like to thank our sponsors for their generous support of Biz Talk. Haley & Associates helps small businesses and individuals not just prepare tax returns, but plan for the future. Haley & Associates, personal connection, positive results. Wherever you are in life or the life of your business, Johnson Financial Group works to match the banking and wealth services needed to help you complete your vision. Thank you to the Business News for promoting our program in the biweekly business newspaper serving Northeast Wisconsin. It is the latest business news and topics for the region. We are grateful for the support of Community First Credit Union. At its core, Community First is a community of member owners where people work together to improve their financial well-being and help one another. New North, the Regional Marketing and Economic Development Corporation, is an active supporter of SCORE. The New North facilitates economic growth and helps people in this region live their best lives. And finally, since 1919, Baird has guided families through investment, trust, estate, and tax planning advice. So no matter what the future brings, you can be confident you're ready because your family is Baird's focus. And now we're going to turn back to Patti-Jo and Justin. And could you let our listeners know how they can contact 5-Star Insurance Group?
Absolutely. 5-Star Insurance Group is located in Appleton, Wisconsin. We're on the corner of College and McCarthy, on your way to the airport. You can reach out to us. Our phone number is 920-831-3210. You can also go onto our website. On our website, you can reach out to any of our salespeople. Also, if you want to sign up for one of our Medicare educational events, hit the event page, and you'll be able to see when we're having our next Medicare 101.
Okay. And being near the airport brings up the fact that you don't just cover Wisconsin, you do cover the snowbirds. Can you let people know what states you operate in as well as Wisconsin?
Absolutely. We are also located and sell Affordable Care Act or marketplace plans and Medicare in Florida, Texas, North Carolina, and Arizona.
So snowbirds, are you aware of that as you are looking for a broker to work with? With that, Rick, I'm going to turn it over to you to wrap up the last part of the show.
All right. Patti-Jo and Justin, I got to say this has been a really great program today. I really have learned a lot, and I know there's a lot out there for folks to know and to learn. So if someone is thinking, hey, I really haven't thought about this stuff yet, and they're starting to get a little nervous, at what age would you suggest to someone that they should come in and talk to you?
Well, if it's Medicare, they definitely want to do that probably 6 months before they turn 65. If it's the marketplace, if they're looking to retire, probably 3 to 6 months before they want to retire. You want to do it within the same year. Otherwise, if they say, oh, I want to be ready, I want to know what it's going to look like in 2 years, we really can't tell you that. The rates for the marketplace under 65, they come out in November every year. The Medicare Advantage rates, they also come out in October of every year for the following year. So you don't want to think too far ahead, but you definitely want to be prepared. Do you have anything else to add?
Nope, that's 100% correct. Yeah, you don't want to do it too early because otherwise you're going to be like, well, how could this much have changed in 1 year? A lot changes in 1 year.
Yeah.
Well, it's good to know too. That's one of those things that, you don't like all of a sudden wake up thinking, hey, I haven't done this yet. Well, that's probably not a bad thing at this point, right? For this particular, focus on our retirement. Just to ask you real quickly before we wrap up here, are you guys having fun doing what you're doing?
Absolutely.
For sure.
Yeah. It's fun helping people and they'll come in the office and feeling very frustrated, and then they leave with a smile on their face or a laugh out the door. Yeah, it's very fun.
All right. Well, Patti-Jo, I really appreciate you coming in today. Justin, I appreciate you coming in. And folks, we've been talking with Patti-Jo Heinritz and Justin Zastrow from 5-Star Insurance Group. Make sure you check out their information on their website. And we really appreciate you listening in today. And thank you for joining us. And we will be back here on next Saturday morning. And until then, have a great week, everyone.